this topic that we're going to talk about today, fibromyalgia, it's really important because it just doesn't seem like there's very much information that's helpful out there. I mean, I even looked on the internet to try to find things to be helpful about it. And other than medications, of course, I just really didn't see too much to help people. So I was really happy that you were willing to talk about that today so that we could help people. So I wanted to start off with our true or false questions.
Sounds good.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
Okay, so our first question is, fibromyalgia is a diagnosis for middle-aged women. So everybody, you type in true or false. What do you think? And Dr. Scheuer, tell us what your answer is.
Okay, so yes, it's more common in women. It's about 10 times more common in women than men, but that doesn't mean that it doesn't happen to men too. So it is not just for middle-aged women.
Okay, well, that's something that I think a lot of people, that cleared up a little myth for people. So now if we're going to be talking about who's affected, let's do another true or false, and that is fibromyalgia only affects older adults. True or false, guys? Type it in. Dr. Scheuer, take it away.
So absolutely not. It's actually something that can happen anywhere from about age 25 through age 60 is where it's most common, but it can get more prevalent as you get older. And it's interesting. I mean, about 2% of the population in America has it, but as you get older, it's up to about 10%.
Wow. It feels like more people have it than that, because I just feel like I hear so much about it. But that's still, I mean, it is still a lot of people. So let's do another one. Fibromyalgia and arthritis, are they the same condition? True or false? Okay, Dr. Scheuer.
Well, those people who saw me shaking my head, no, that is false. So basically, fibromyalgia is a pain syndrome that affects muscles, tendons, ligaments, but it's all without inflammation. So arthritis is an inflammatory thing. See in arthritis, labs that are up, like inflammatory labs that are up. But in fibromyalgia, the labs are normal.
Interesting. So what are some of the fibromyalgia symptoms that people might come across?
So we used to check for fibromyalgia by pushing on different areas on your body, and you had to have a certain number of areas that were tender spots. But now it's really fatigue. So that's a big thing. You're tired all the time. You wake up not rested. Pain, and it's usually generalized pains. There's certain points where you might feel more tender, but we don't use that as our diagnosis anymore. And then there's cognitive problems. So it's not only memory loss, but it's attention. And so those are some of the major things that happen with fibromyalgia. Otherwise, you have normal exams, you have normal blood work, you have normal CAT scans, you have and other things like that. But we do check to make sure, we check your thyroid function. We check if you have diabetes. We check if you have Lyme disease and other things, because other things can, one be what it is instead of fibromyalgia, or two, trigger fibromyalgia and be associated with it. But fibromyalgia is often associated with an injury, a previous injury. So traumatic injuries when you're young, traumatic events when you were young, it can be associated with that. And it's interesting because, so that's part of it. And we'll talk more later about other issues.
Okay, so are you saying that there's not there is not a test? Is there a test for fibromyalgia?
It's a test of exclusion at this point. Mm-hmm. So you have to exclude everything else, and then you diagnose with fibromyalgia. And so right now, there's associations like family history. If your family members had it, there is a much more highly likely you had it. You have it. And then there are some genetic factors and things like that that can be associated.
Wow. So now, I think it used to be that there was a certain amount of time that would lapse for you to have symptoms before it would be considered that. Is that still the case?
It's usually over 3 months of continuous, symptoms.
Right.
But
So,
it also can wax and wane, but it's diffuse pain over 3 months.
wow. So you could have normal blood tests, normal blood counts, and still have this happening.
Yes. Well, I mean, that's the part of it, is the lab tests are usually normal. Now,
Hmm.
if you have thyroid issues and we treat the thyroid and the symptoms go away, then it wasn't fibromyalgia, it was thyroid issues. If it continues despite having now normal thyroid levels, then we have to consider that it's fibromyalgia.
Wow. So are there other conditions that you might be treating alongside, and then maybe those might go away, and then you're saying, and then but still there are
Yeah.
symptoms that are happening.
Yeah. So, I mean,
Yeah.
pain, fatigue, mood difficulties, things like that, sleep abnormalities are all involved with fibromyalgia. But you can have depression and anxiety separate and have fibromyalgia also. So you have to separate out, is the mood disorder from a depressive disorder or an anxiety disorder versus the fibromyalgia. You could have both, which is frustrating. If you have chronic headaches or chronic fatigue syndrome, so chronic fatigue syndrome is different than fibromyalgia. So you can have both of those together. Some people with fibromyalgia end up having things like a sensitive tongue, weird feelings in their fingers, environmental sensitivity. So there's lots of things, sound, light, or odor sensitivities, like light just gets them. And so I see people coming into my office with dark glasses when they have nothing else wrong, and that's part of their fibromyalgia. So it's a difficult one to tease out from other ones. Some people who have rheumatoid arthritis have a tendency to have a little bit more fibromyalgia too. So, but that's a different disease. Remember, the fibromyalgia is not inflammatory, whereas the rheumatoid arthritis is.
Right, because if it was inflammatory, then the markers would come up with
Correct.
diagnostic testing.
Right.
So if somebody thought that they had fibromyalgia, how would they get it diagnosed?
So first thing would be see your general family practitioner or your general doctor, whether it's an internist or a family practitioner or somebody that you trust and knows you well. And then, or you can come to plant-based telehealth and we can talk to you about it, because we would tease out, the doctors at plant-based telehealth would help. And this is an online program where you can do telehealth visits. We can help tease out what's really going on. Is there something else that we need to treat? And then if that treats the fibromyalgia, great. If not, then we can work on working on the fibromyalgia. And fibromyalgia can be really scary because you have a lot of issues. You can't sleep, you have pain, you're feeling terrible. But it's one thing is that's good to know, once we've ruled out all the other stuff or treated other things, that fibromyalgia is not life-threatening. It's life-annoying, very seriously annoying, but it's not life-threatening. And there are a multitude of things you don't go through one thing. There's lots of ways to work on it, but it's a multidisciplinary way to work on it. So it can be medications. It's certainly lifestyle. And there's different kinds of medications. There's lots of other things that you can do. First of all, definitely working on sleep habits, working on exercise. Now, a lot of my patients who have fibromyalgia, if they exercise too much, then the next day they can't move. Yeah. So we have to work on the right balance of exercise, but movement is very, very important. And things like yoga are helpful. And at least 3 times a week, I want you moving, and walking is a great way to move more. You have to move your body, because if you don't, then you won't help treat fibromyalgia. There are other options like hypnotherapy, cognitive behavioral therapy, acupuncture, TENS units. There's tons of things we can use, including counseling, because it may not be the fibromyalgia that we need to treat with the counseling, but it's how you deal with it and how you live with it, because you certainly can live and function well, even if you have it, even though it's scary. We can get the symptoms under control and help you live your life very full and happy.
Well, that's so comforting to know, because I know of some people that do have it, and I think of it kind of like an iceberg,
Yeah,
where
exactly.
people from the outside, we kind of see that they're suffering a little bit, but we have no idea
Yeah.
what they're really feeling, and that must be comforting. And just to remind everybody, if they haven't seen you on the show before, that you are a practicing physician for plant-based telehealth, and I put it up in the show notes, also a link. And I think this is one of those times that it would be so appropriate to consult with you or one of the other docs on board, because somebody who has fibromyalgia just may not be comfortable moving and traveling, and they might just not feel good about, just like you said, walking around with sunglasses. So this is something that a telehealth, it would be appropriate, at least for an initial visit.
And we currently have 9 physicians. We cover all 50 states and DC. We see people from overseas. And so you can go on to plant-based telehealth and look for, if you want to look for a doctor, you say which state you're in, because it's important what state you're in to which doctor you can see, and put your state in, whether you're Medicare or not, and then it'll pop up which doctors are licensed to.
Okay.
And we work well with each other.
Great.
Yeah.
All right. Well, we're going to take some questions. And you guys, if you have a question for Dr. Scheuer, please go ahead and post it. And we'll be asking some of them now. And we may be holding on for some of them later as we go through the presentation. But I just wanted to get started here. So you talked about sleep. So I think this is a good question. So Jen wanted to know, do you have any tips for better sleep with fibromyalgia?
Absolutely. So it depends on why you're not sleeping with fibromyalgia. Is it the pain, or is it stress, or what's going on? Are you having troubles falling asleep or staying asleep? So that's where you can come to plant-based telehealth, and we'll get you more information. But there's a couple of good websites to look at just before you come in. So there's lots of behavioral things that you can work on, like keeping your room at night cold and dark. That helps with sleep. Getting off of computers or the phone, or anything that's Bluetooth, blue light for at least an hour or 2 before you go to sleep. Making sure you're not having caffeinated beverages too close to sleep. There's lots of things. So sleep is very complicated, but there's a good website by Dr. Huberman, the Huberman Lab, and they have a sleep checklist that's amazing. And he has really technical information onto the science of sleep. But with fibromyalgia, if you're doing all the right things in terms of sleep hygiene, not eating close to bedtime, eating light meals at your dinner, and eating properly. And that's part of a major thing with fibromyalgia, not only the movement, the stressing less, but it's eating a proper diet. And there's a lot, because you want to decrease your oxidative stress, you want to decrease your cytokine responses. And so a whole food plant-based diet is really, really important. And for some people with fibromyalgia, it's a low fat whole food plant-based diet, more raw foods. Some people have to avoid glutens, but it depends. So there's things we need to work on that. We want to make sure you're getting plenty of vitamin D and things like that. And vitamin D affects your sleep. So you want to get early sun, not just, early light, not your light in your bedroom, but early sun exposure to help your sleep later in the evening. So there's lots of things like that. So you can do that. There's some hypnosis things like you can get Calm, an app called Calm, or headspace.com, or there's Sleepio, which Sleepio is another thing that a physician has to prescribe, but I've used it with some of my patients and it works amazing. It's a 6-week course, which is 20 minutes a week. and really adjust the sleep cycle, especially for folks with fibromyalgia. So there's lots of things we can tell you about that might help. But go to Huberman, the Huberman podcast. I think it's his second podcast that is specifically on sleep. That's so fantastic.
Yeah, I know that some people think that they shouldn't have caffeine maybe before bedtime, but I think I've heard that caffeine really has a pretty long life in someone's system. For some people, maybe longer than others.
Yeah, there are fast and slow metabolizers of caffeine. So some people who have a cup of coffee at 8 o'clock in the morning still have half of it in their system at 10 o'clock at night. So of course they're not sleeping. And there's also melatonin, which tends to help some of the people with fibromyalgia with sleep. But it's a huge thing. And it's
we could just do
we could do one on sleep. But Huberman, that will be a good place to just start, or come see one of us and we'll talk to you about it.
Well, that's great. Yeah, I think that you gave some good tips, and you were talking about sun exposure too. And it seems that lately there's been a lot more information coming out about infrared exposure, and that vitamin D may be an important thing to have a good level, but then maybe it's just a marker for what you really need, which is the infrared.
Correct.
Did you want to talk about that a little bit?
Sure. I mean, there's a great podcast on medcram.com that talks. He has a lot of information about that. But in the wintertime, we tend, and with COVID, we tend to be inside, and we're finding that people who have low vitamin D, have much higher risk of very severe COVID and real problems with that. And that's also associated with fibromyalgia. People with low vitamin D have worse symptoms of fibromyalgia. So we certainly would want to test the vitamin D level and supplement if needed. But it's not just the research is showing it's not just the vitamin D from the sun. It's even if you're outside and have a jacket on and are covered, there is infrared light that gets through that and gets to you and really helps your immunity and your health. So I definitely have, and we see that in patients. If you have patients in a hospital and put them outside, it makes a huge difference on their recovery. There have been some studies on that. So get out, especially in the morning if you're having trouble sleeping. Having that light affect, get into your eyes, which then affects your brain and your melatonin, and all these other levels in your brain, helps you sleep better and helps you heal better.
Right. I think I was able to see some of that with Medcram, and he talked about that as long as you could feel the warmth from the sun, that even if you were your skin was covered, that infrared can go like 8 centimeters deep into your skin. Mm-hmm. So you can it can penetrate even if you have a covering on. So if you're worrying about not being exposed to the sun as far as your skin goes, it's still beneficial. Oh, we have something. Go ahead,
you have suntan lotion on. We don't want you, especially on your face, because we don't want to fix one thing and give you another. So don't.
But even if you put the sunscreen on, you could still get that infrared.
Infrared, correct.
Right. So that's great. Yeah. We just have something nice. I've seen Kathy Cook said, I'm consulting with Dr. Scheuer, and she's great. It's not fibromyalgia, but she has so much knowledge and is very caring. So that's really nice.
Thank you.
Sometimes it's nice to see. Sometimes it's just nice to see that. Yeah. So now you talked about diet. So Trish, you want to know, can a plant-based diet help with fibromyalgia?
Absolutely. There is no question about it. And again, what you're doing with a plant-based diet is you are bathing your body with good nutrition, which helps you heal from anything. And it takes down inflammation, which again is some of the other stuff, not necessarily fibromyalgia, but it helps decrease you're getting rid of foods that are inflammatory, that cause cancer, that have high IGF-1, that have all kinds of negative things that affect your body. It changes your omega-3 to 6 ratio, things like that. So you're not having bad things and what I would consider bad things. And I know people say, don't say there's bad foods, but Cigarettes are bad. We know that. So I do think that, you want to avoid things that cause cancer, like processed meats, like lots of processed foods. Lots of oils can cause problems. You don't want anything, in my mind. You don't want cheeses. You don't want alcohol. Alcohol is associated, can make fibromyalgia worse, and can make breast cancer worse, and can make cholesterol and blood pressure worse. So there's things that you just want to avoid. So by having a whole food plant-based diet that's very healthy, you're not eating the other stuff, which is important. So you're not causing toxins, not bringing toxins into your body. Then you're bringing lots of great phytonutrients and good ingredients that bathe your body with nutrition and nutrients and help you heal. And that's so important. With fibromyalgia, you've got to worry about fats too. So you want a low-fat whole food plant-based diet that has lots of probiotics in it, because you want to affect your gut microbiome. So you want lots of fiber in there, which will help you heal better from, help decrease the symptoms of fibromyalgia. Some people, like I said, may need a gluten-free diet, but not everybody. So those are some of the things that, yes, there is no question. I've had quite a few of my patients, when they go on a plant-based diet, they lose weight. So that their joints don't hurt as much, and you don't have the other pain. And then their fibromyalgia symptom, they're able to move more, which is an important part of fibromyalgia for treatment. And it also changes the serotonin in their gut and in their brain, which helps all the mood changes. It helps you sleep better. So yes, being on a whole food plant-based diet is no question the best option for fibromyalgia and everything else. But
Right. I think about how people who maybe they don't have fibromyalgia, but when they report that after adopting a plant-based lifestyle, that some of their brain fog lifts, that they start to feel a little less achy, a little less irritable, that things that they didn't even really realize that they were experiencing, they just thought they were normal to feel, maybe for their age, or just maybe because all the people that they associate with feel that way. So you would think that maybe there may be some other symptoms that are on top of what the person who has fibromyalgia is experiencing, and maybe some of it could be relieved. So
there's also another aspect of the plant-based diet that helps. When you're eating a plant-based diet, you're eating a higher nutrient density, low calorie diet. And they have found that some people with fibromyalgia do better with a hypocaloric diet, which is, not as many calories. Now, you can starve yourself, but why do that when you can already cut your calories, maybe 500 calories per day, just by switching your diet to a plant-based diet and still eating as much as you want? So you're not hungry, and you're getting all the nutrients you need, but you're still cutting the calories. So that's another way, by switching to plant-based, that it's hypocaloric, and that's been shown to help some people with fibromyalgia.
wow, that's kind of a really win-win for that. That's wonderful. Okay, so I think we have another question. Let's see. Oh, okay, so we're talking about diet. So Wendy wants to know, what food should I eat or avoid if I have fibromyalgia?
Okay, so again, anything that had a mother or face, get rid of. So no cheese, no eggs, no animal products, so meats and fish and things like that. And you want to consider increasing your omega-3s, okay, compared to omega-6s. So you can do an elimination diet and get rid of certain things, like some wheats and some citrus fruits in the beginning, but things like that, because some people react to them. But eventually you want to bring back as much as you want. You want variety. Some people say a low FODMAPs diet really helps with fibromyalgia. And so, you can still have tons of stuff, like you can have soy products, bok choy, chia seeds, flax seeds, kale, broccoli, oranges, things like that. You can have quinoa, you can have buckwheat groats, you can have teff, sorghum, spinach, sesame seeds, tofu, tempeh, lots of really good things like that. You can have fortified things. You know, you can have some soy milks to make sure you're getting in your good phytoestrogens. You can have pumpkins and nuts and seeds if you have a small amount of them, not a lot. Wild rices, you can have all kinds of things. So you can start just with really simple and start with brown rice and some cooked fruits because you can digest those better. You can have some cooked greens and yellow vegetables and orange vegetables like asparagus and broccoli and chard and collards, spinach, sweet potatoes and taro. And then as your symptoms decrease and improve, then you can start adding in some of the other ones that you've taken out one at a time to see if it triggers you, because you don't want to be triggered. And if it triggers you, stop it again, wait for 2 weeks and try it again. If it triggers you a second time, then let's get that out of your diet for now. But as people change their gut microbiome, as they get healthier, I've found people eventually later on can add back more things. So my thing is start plant-based, whole food plant-based. If that's not decreasing your symptoms, switch over and do more of an elimination diet and then add more and more things. But we can help you work with that at Plant-Based Telehealth. There's quite a few, all of our doctors know how to do that and help you be really specific about what to do.
Wow. That must be such a relief for people to hear, that they actually would have a physician that could be on board with trying this lifestyle and actually help them tweak it, because it's an individual thing. It's not just a one size fits all for everyone, like you said.
And it's not just foods. But it's stress, it's sleep, it's community, it's a whole bunch of things. And then we are all physicians. So if you need medications, one, we can help you. Two, if you're on medications and you're doing better and want to get off, every single one of us loves to get our patients off of medicines, because we're so lucky we have some medicines around that can help us. But I'm all for the least that works. And so if you don't need it, don't use it.
I like that. The least that works. That's a really good one. Okay. So Pam said, I heard Dr. Furman said that fibromyalgia patients should avoid fried, baked starches. I'm not sure why. What do you think?
When you fry, first of all, you should never use anything with oil. Okay. So if you're frying, make sure you're either dry frying or like dry sauteing. And that's putting, like getting your pan really hot and putting your onions in and letting the natural oils come out of it, or using water, or using a low sodium or no sodium vegetable broth. Those are all good ways to do it. But when you cook foods, it changes them a little bit. It's the same thing, so some things get better when you cook them. Some things, get more nutrients that come out, and some things get less. Some, like, you want to cook your mushrooms. You would never want to have mushrooms technically that are not cooked. There's some kind of
Carotene, I think.
In there that can be a problem. Tomatoes, it's really good every day to have a little bit of cooked and a little raw onion, just a little bit of both, because each one has their own positive effects. So overall, with fibromyalgia, when you're cooking, you can change the aspects of the food. And so the raw tends to work better to fix your gut microbiome originally. And that's probably why he's saying that.
Okay. Maybe he might have been talking about acrylamides or something too. I'm not
right.
sure.
Well, you think, and that's a very good point. I'm so sorry. Acrylamides are very important for, especially with meats and things. When you're cooking and browning, you get some acrylamides, but even with cooking some vegetables, you can get some on, and that can be more damaging than not. And when you're trying to reverse a disease, you want to not put anything damaging in your body. Right.
So if maybe we could explain what would a food look like, we could actually know what it would look like if it was forming acrylamides.
So it's that the browning, crunchy kind of thing on the foods is what you see. So when you're raw, you don't actually have to have it not cooked at all. You can use very low temperatures for longer times. And then you don't get that browning effect and that crunchy effect on it.
Or you could steam something, even if you do want to be strictly raw, you could still steam it or wok it without getting the browning on it. So, and then talking about food, Gina want to know, would juicing be appropriate to add to the whole food plant-based protocol for fibromyalgia?
Gina, that's a really good question. And I don't know if there's any true studies out there on juicing versus not. The way I like to do things, and I juice occasionally when I'm, but not often, because I like keeping the fiber in. So I do smoothies more than I juice. So I like keeping things as whole as possible. So when you juice, you're getting rid of a lot of the fibers. And with that, probably some of the micronutrients. You still have quite a bit in there, and that's good. And that may be a way to start things. Like, for example, after we do a surgery, we might start people with a juice to get their gut microbiome going, and then add the smoothies, and then add the real foods. So as much as you can, go to the real foods. But if you can't, like if you're unable to eat as much as sometimes a plant-based diet does to maintain your weight, you can make a smoothie, put that in, and you can get much more concentrated stuff. Now, you never want to drink the smoothie or the juice really quickly, because if you drink the juice or the smoothie quickly, you're going to get a lot of sugar into your gut at the same time, and the absorption will be much faster, and it's faster with the smoothie, with the juice than the smoothie. So the smoothie has a fiber that's really important. You're breaking down some, but it helps decrease how quickly you absorb the nutrients. And if you absorb the sugars too fast, you get an insulin spike, which increases your IGF-1, which increases inflammation. So I would go more towards the raw whole foods first, or, steamed or slightly cooked, but low temperatures. And mix it up a tiny bit. Variety is a very good thing in my mind. And then if you have to, then go to the smoothies. And if you really can't handle that because, something else is going on, then you can go to the juice. But again, drink it slowly.
Oh, that's very good. That's good to hear. Okay, so we're talking about eating. How about this? So Wilma wants to know, can fasting help to heal?
Absolutely. Yes. So there is a lot of research on fasting and how it affects our bodies. And again, fibromyalgia is not so much a inflammatory thing, but our bodies repair when we fast. And that's why sleeping is so important, because we need time to repair. And you need time to repair when you have fibromyalgia. And so there's quite a few different ways to fast. You can do, eating certain times a day. So stop eating at 6 o'clock at night and don't eat until the next morning at 10 o'clock in the morning or something, or stop eating at 4 o'clock in the evening and then don't eat till the next morning. And that's a everyday timed fast where, maybe you're eating only 10 out of 24 hours, or only eating 8 out of 24 hours. And that really helps to let your body recover. There's also fasting where you do a 24-hour fast. So or a 36-hour fast. So you can eat dinner one night and not eat until the next night's dinner, or not eat until, give yourself a good time to fast. I do not suggest that you do fasting of over 2 to 3 days without a doctor's involvement, because you can get into trouble with that. But there are places like True North in California where they water fast people for, I think up to 40 days. And it really changes. Yeah. It changes it has helped people reverse, lots of diseases. But that is very, very closely monitored with blood tests regularly with you. And also when you're fasting for that extended period of time, you're not moving. You're not fasting and then doing a 10-mile walk. That's not a good idea. So on your fast days, I would do less exercise. And if you're going to fast more than a couple of days in a row, don't do it without supervision.
Yeah, that's very good. Very good advice. So, Brandon want to know what are easy whole food plant-based meals I can prepare? I have extreme fatigue due to fibromyalgia.
So, Brandon, that is an excellent question. Whether you are fatigued from fibromyalgia or just busy because you're working and have kids and you just don't have time, batch cooking is a really great thing. And the things I love in my kitchen are my Instapot and my Vitamix. Those are two things that I use almost every day. But the Instapot, you can batch cook a bunch of grains, or you can, your Instapots also can slow cook. So you can put something in the morning or in at night and put it on a timer, or slow cook it overnight, and you'll have food for the next day. So some soups, especially in the wintertime, soups and grains and things. So I batch cook a bunch of grains, and then I put them into single serving dishes and put them in the fridge. And then I take them out when I need them. Salads, things like that. You can go to the grocery store and get a whole bunch of pre-made salads. Don't use the dressings and the other stuff that they put in there. Give them to your dogs or your cats, or, to friends or something like that. But just use those salads and just munch out of those salad bags. Those are easy. You don't have to prepare. Frozen foods, like frozen veggies and frozen fruits. That's what I do, because my fruits go bad and I hate wasting food. So I just get a whole bunch of different frozen fruits. And so I have my batch cooked grains. I put the frozen fruits on there, let them defrost, and then I have my breakfast. So those are easy, quick things that can help. That's what I think. Amy, do you have other suggestions?
Well, I have a playlist on my YouTube channel called Hey, I Can Make That. And I created it because I'm not one that likes to cook in the kitchen. I just want something simple and let's go. And so these are just meals that are just, maybe you can even just dump in salt-free different things that you get in cans and mash them up, and there you go. So they're just very quick, easy things that you can do to if you can't stand long or you just can't do very much at a time. So I'll put a link to that too. But I agree, the batch cooking is just, yep, that is just awesome.
And the Instapot's great because you press the button, you leave. You
Yes.
go rest, you come back, and it's ready. You don't have to pay attention to it. It's just wonderful. And you can make just all kinds of wonderful meals in there.
Yep, very good. Okay, so, Ellen wanted to know, can fibromyalgia cause shortness of breath?
Okay, so technically it doesn't cause shortness of breath. However, if you are deconditioned because you haven't been moving because you have fibromyalgia, that can cause shortness of breath. And, but I would want to have you seen by myself or one of us in our practice to find out exactly what you mean by the shortness of breath, how long it's been going on, and is there another reason for that? But certainly when you're deconditioned because you're so fatigued that you can't move a lot and you start to move, you can feel shortness of breath sometimes, but it's the deconditioning, not the fibromyalgia itself.
Okay. And Carla wanted to know, can fibromyalgia cause pain on the top of the skull?
Interesting. Probably yes. And in fact, I think I've had some patients who've had that. It technically usually is in different parts of your body, like your back, your shoulders, your legs, things like that. But I've had, and it depends on what kind of pain you're having. Is it sudden? Is it long? But I've definitely had people who've had different pain syndromes. Now, the other thing with fibromyalgia is it's a perception of pain. Now, that doesn't mean you're a weakling or anything like that, or there's anything wrong with you. It's this hypersensitivity that your nerves have to things. And so instead of feeling a touch like somebody else who doesn't have fibromyalgia would feel, it actually feels like somebody's burning your skin with, a match or something. So it's a perception issue. And we think that has to do with, it could either be, the nerves itself are damaged, or there's a problem with the neurons and the sensitivities in the brain in perceiving that. It's real. It's a real hypersensitivity issue. And so, yeah, if you're having areas of your body that just have extra pain, it could be a hypersensitivity thing.
Interesting.
Yeah.
Wow. Well, now you are a medical doctor, you're an MD, but you're also a lifestyle medicine doctor. And I think that's so appropriate to talk about lifestyle medicine today, especially. So, do you want to start with one of the pillars of health and how it relates to helping people with fibromyalgia?
Sure. Well, first, before I forget, because we were just talking about pain, there's a great book called Explain Pain, and it's by David Butler and Dr. Lorimer Mosley. And it's expensive. It's really expensive. So if you can find it at your library, it's a great place to go. But it's a great one to explain pain. And then there's some TED Talks about pain that are really good on fibromyalgia and pain and the pain sensitivity and the pain perception issues. But off to lifestyle medicine. So there are 6 pillars of lifestyle medicine, and then Rochester Lifestyle Medicine Institute has added 3 more.
Oh,
but,
okay.
Yeah. So obviously it's nutrition. It's what you feed your body. It's sleep. It's stress. It's avoiding toxins like alcohol and processed foods and cigarette smoking. So if you have fibromyalgia and you smoke, stop today, please. I'm trying to think. Okay, so I don't know if we've mentioned sleep. It's connectivity with other people. It's finding a purpose in life. It's getting, and so Rochester added the purpose, getting outside, and can't remember if theirs was laughing or not, but finding enjoyment in life. So laughing is really important. So if you have fibromyalgia, put on some really good comedians on the screen, not before bed, and laugh and learn, practice. Just like anything else, you have to practice at it. You can practice at laughing. You can practice at getting involved in a community. So getting on a fibromyalgia support group, getting into, plant-based telehealth, or there's other options out there like Rochester Lifestyle Medicine Institute has some modules on how to appreciate life more and be happier. So get into those. Meditation, stress reduction, that's all a part of, like I said, it's a multimodality treatment for fibromyalgia. It is not one thing. It's not just meds. It's not just food. It's not just sleep. It's all those together, and you need to incorporate as much as you can to get your energy back and feel better.
Yeah, I think about laughing and meditating, and it seems like they have that. One of the things they have in common, other than just getting your mind away from other things, is that it forces you to take in deep breaths.
Yeah.
Breathing,
so important. And especially before bedtime, I do a lot of deep breaths. There's different options. Like there's a breathe in for 4, hold for 7, out for 8. If you do that several times, that actually has been studied against lorazepam, which is a medicine, and works really well for bringing down anxiety. There's cognitive behavioral therapy to help change your mindset against what's happening. So we can have pain, and pain's one thing, but we don't want to suffer along with the pain. And that's letting pain control our lives. So massages, if you in this time where it's really hard to get the contact that we need, the hugs that we need, get a massage. If you have somebody who you trust, who will, is being very, very careful about COVID and other things. And there's other options for fibromyalgia. There's newer treatments out there that they're thinking about. But start with the basics first.
Okay. This isn't a question, but I want to put this up. Apple 369 said, one of the hardest things with fibromyalgia is the dismissal of our reality and the stigma.
Yeah.
Yeah. I thought that was so important to put that up, because I mean, I'm not going to ask you to talk about your patients, but you have had patients. You're a medical doctor, and you've had patients, right, that have had this.
So yes, I have. And I've got to say that when fibromyalgia first came out as an entity, we didn't know anything about it. And doctors hate that. They hate not knowing. And they hate not feeling like they can help somebody. And so it was a big stigma, from the doctor community, from the medical community. And it's also a stigma from, your family and friends who you look normal, you look like you should be fine, and you are normal, but you're not fine. You know what I mean? You're tired, you have that fatigue, you have the mental fog, you have, the pain. Chronic pain is so devastating. It's so energy sapping. So just the pain itself makes you tired and makes, so it's really a sad thing that that's a reality of fibromyalgia and a lot of other things, but specifically fibromyalgia, because we're only beginning to learn that it really is a physiological issue. And it's not just this, some people used to think it was made up, or it was people trying to get out of work, or people trying to get out of doing their responsibilities. And it's not. It's real, and it's tough for the people who are going through it and their family members, and their supporters. It's really tough. So there are now, one of the good things about COVID is there's a lot of online meetings and groups that you can hook into, and so hook into that support. From people who really have experienced it and know it and have tips for you to get through every day.
And that would also help you with your community, because that's
absolutely
one of those pillars that you really need to address. Rebecca wanted to know, is fibromyalgia causing my fever?
That's a good question. Probably not. So I'd like to find out what else could be causing your fever. Do you have, a low grade infection somewhere, like a tooth infection that's low grade, so you don't even feel it yet? Do you have something else going on? So no, I don't think the fibromyalgia itself is causing the fever. So definitely get seen and make sure that your labs are good, like your white count, your red count are good, and not something else is not happening that you don't know about. A low grade underlying urinary tract infection, tooth infection, or something else.
Yeah, and those kinds of things can really make your whole body feel not well anyway. So
right, and that will make all the symptoms of the fibromyalgia worse.
Yeah. Okay, so Sandra wanted to know, should someone with fibromyalgia avoid the COVID vaccine?
Honestly, Sandra, no, absolutely not. I actually think that it's another reason to get it. We haven't seen an increase of fibromyalgia with the COVID vaccine, and so that's good. We, there are certain people who have other things that they shouldn't get it, but it's very rare, and there's reasons why you shouldn't. But the COVID vaccine has proven to be extremely important in preventing death and hospitalization from COVID. And honestly, for example, even in my family, when my father was sick of something other than COVID, he was not able to get into the hospital for the help he needed. And so we see a lot of people with cancers or pregnancies that get like pregnant women who are getting sick because people aren't getting the vaccine, or people not getting into the hospitals for the surgeries they need. My mom, even, she had to wait, I think it was 2 or 3 months before she could get into the hospital to get the hip replacement she needed. So she was, crawling to the bathroom because she couldn't get the surgery she needed. So fibromyalgia is not a reason not to get it. And I do support getting it.
Okay, I'm glad that question came up, because I think that's really, really important to talk about. Okay, so we had another question, and that was, because we talked about some activity. So John wanted to know, is it advisable to push yourself to do everyday physical activity if you have fibromyalgia?
I think it is important to do some physical activity every day. Now, pushing yourself is interesting. How much? It's that balance. I do think at least 3 times a week you should have flexibility and strength training. And whether that's just being at home and stretching, or just being home and taking the cans of, like a gallon of water and lifting it while you're sitting, if that's all you can do. It's important. I think walking is very important and doing that every day. Now, with fibromyalgia, you don't want to sit there and push yourself and do nothing for a couple of days and then do an hour of work. You can't do that. That's going to knock you down. So don't. But even if you do 5 minutes in the morning when you wake up of just stretching and moving and things that move your body, get it going. And then what I suggest is after every meal, get up and move. Whether you're walking around your house, go outside, walk around the block once. Do that 3 or 4 times a day if you can. So break it up so that you're not overextending yourself at one point, and then it'll knock you out for a day or two. So I would like something every day, then the stretching and the flexibility at least 3 days. And 5 minutes at a time, if that's all you can do. If you're sitting here watching this podcast and you stand up and just walk in place for 5 minutes, that's fine. But do that several times a day, and that should help. You'll notice, especially if you do a diary of your symptoms and your pain and your energy, if you can up it a little bit, even if it's every week, up it by 5 minutes at a time every week, you'll get to be better than you were before. And that's good.
Wow, that sounds like a great idea to keep a journal, because earlier we were talking about food and maybe some intolerances and things. So I guess if somebody just had that journal where they would maybe talk about the food that they're eating and their movement and what else.
So what I do, because I personally have had to journal, not because of fibromyalgia, because of my food addiction, I've journaled with, I write down everything I eat and this is for me when I'm, getting tempted by things because I really want, or if I've had I'm a chocoholic. So if I've had some chocolate, then I want more and more and more. And so I try and avoid it in the first place. But sometimes I have to go back to my diary, and I have food on one side, exercise on the other, and then I have mood. And I just put in, at different times of the day, a smiley face or sad face or a straight face or something like that. Something that's really quick to tell me how I'm doing. And I find that helps a lot. And as you said, Amy, it's very important if you're trying to do a food elimination, or if something you think triggers you, when you look back, you can really see if it does trigger you. And you've got to remember too, though, what you eat right now may not be immediate response. So some people with like peanut allergies, they eat it and they immediately get a response, but some things stay in your system for a while. So you want to see what you ate today and how you feel the next day. And then, and so keeping that diary is so helpful. And I see a lot of people who think they're not doing better, but they'll send me their food diaries and they're like, oh gosh, I'm not doing any better. I'm like, look, when you first started, you were unhappy every single day and you had pain every single day. Now you have pain every other day and you have many more days of happiness. It is getting better. We forget that, things improve. And it's nice to look back and say, oh yeah, that's where I started. And here I am 12 weeks later, a different person. So.
Wow, that's so encouraging. And I wanted to share, because Apple said, my Fibro Journal records my sleep, mood, weather, food, social interaction, and creativity play. So those are really good things to record.
Yeah, I think that's wonderful. I think that's wonderful. Keep that up.
Yeah, very good. Okay, so Richard wanted to know, can fibromyalgia cause muscle twitching?
Yes and no. Again, this is it's hard to tell whether it's really the fibromyalgia or it's the inactivity, but it also can be some other things like some electrolyte imbalance or some mineral imbalance. So Something to check would be zinc or your magnesium or things like that. Also, there's other things that can cause muscle twitching, so we need to make sure that it's not something else. So I would suggest talking to your doctor about that. Stress can cause intermittent muscle twitching. And so fibromyalgia stresses you. So yes and no. That's something I'd like to have somebody talk to you professionally about to make sure that there's not something else going on.
Okay, Deb asks, are there effective medications to address fibromyalgia pain?
Well, that is a great question. And one of the things I will start with is opioids are not a good option. So if you have a doctor who says, here, I'm going to give you some, opioids for that, don't go find another doctor. Okay. Because that's not really the treatment. But so for medications, there are things like non-steroidal anti-inflammatories, alone or in combination. So that would be an Aleve with Tylenol or something like that. There's tramadol, which can help, but which is prescription. There are non-pain meds that work on pain. Like there's a SNRI, serotonin norepinephrine reuptake inhibitor, that works really, really well, called Cymbalta or duloxetine, which I found works really well with some of my patients. When it works, it's phenomenal. When it doesn't work, it doesn't work. But there are SSRIs, SNRIs. There are, let me think. There are other things like gabapentin or Lyrica, which change the nerve perception of pain, that sometimes work. But remember that every medicine has a side effect. So again, you want the least that works. You don't want to be on too many meds and it's not working. So that's where there are some good medications out there that can work. I'm just trying to think of what other things out there, but it's not meds and ignore the lifestyle part. You have to have the lifestyle part too. So it's a combination if you need the combination with the meds.
Very good. So we've had a lot of questions and we're probably going to get more coming in, but I wanted to kind of stop and ask you, is there something that we haven't talked about as relating to fibromyalgia that you wanted to talk about?
It's interesting because, when the gentleman or the person earlier was talking about is this real? Is this stigma? And people thinking it's not real. There are certain meds like naltrexone, which is an interesting medicine, which works against in the opiate parts, that would do nothing for somebody who doesn't have fibromyalgia, but has been shown to maybe do some changes on there. There's new options like there's for really severe cases, and I mean this is really severe. Transcranial direct stimulation, magnetic stimulation. There's acupuncture. There's hypnosis. There's some inconsistent stuff on probiotics and replacing some things like zinc, but that's where I'd like to see, like vitamin D. I would like to see your vitamin D level, your zinc level, to see if you're low. Let's replace that, and that might help. Again, I think we talked about the diet, so no, that's not anything else. So those are the things that I'm thinking of. Let me just see if there's anything else. Obviously, I think we talked about that. Hypnotherapy works. Biofeedback can help. Heart rate variability can help. I'm just checking my notes.
So these things that you're mentioning, you wouldn't be able to perform all these things, but you would be able to, if somebody made a telehealth appointment with you, you could tell them how to give them resources for these things?
Absolutely. So with plant-based telehealth, we can check labs. We used Quest or LabCorp. And so we find whatever is near you, and you can do that way. Or we can suggest what labs to have your doctors check. We can prescribe medications. So there are medications that we can prescribe. And so we can, you let us know your pharmacy and we can talk about them, or we can de-prescribe medications, even better. And then we can hook you up. Like I mentioned Sleepio for sleep is a great option for, it's a cognitive behavioral therapy specifically for sleep that's online. And I can prescribe that for people. So there's option, and we can suggest physical therapy, which I think is a good option. If you haven't been moving or you have questions about how to move correctly, I can certainly give you ideas about how to slowly increase your resistance training and moving more. So there's lots of things we can do. And we can also try and see, is there anything else that is happening that it's not fibromyalgia? So all of our docs can do that for you.
Excellent. And again, I wanted to let everybody know that if they wanted to contact you or any of the other docs, they could go to plantbasedtelehealth.com, and we'll put a link right in the show notes so that they can go directly to it. And all of you that are watching or listening, tell us, what are you going to remember from this broadcast? What is your takeaway? Because a lot of times when people are searching for answers, sometimes they just read comments before they even look at a video, and that could help them a lot. And you have just been so helpful, Dr. Scheuer. This is such an important topic, and there's so many people out there that are looking for answers, and I really think you gave a lot of answers today, and I so appreciate every time you come on, and I hope people will go and check the other videos that you broadcast that you've done with us in the past, because you're just always so super awesome when you're here.
Thank you. It's such a pleasure. You do such a great job of getting the message out there, so thank you.
Oh, well, thanks. So I wanted to also thank Jess Task Voice, and she did the introductions and she did the countdown. She's doing quite a lot of things, and she's even going to tell us who's coming up next.
Executive producer of the movie The Game Changers, Gwyn teaches Kickstart classes at her educational restaurant, Green Fair Organic Cafe. Join us for a Q&A with Gwyn Whitaker on Wednesday, March 2nd, 3 p.m. Eastern, noon Pacific, on Be Green with Amy Live.
Well, until I see all of you guys again, if you could please type in the notes in the comments. You could type in my tagline, which is be strong, be well, and be green. And Dr. Scheuer, she's so talented because she also does sign language. We didn't talk about that today, but she does. So if you can join me and Dr. Scheuer when I say my tagline. Are you ready, Dr. Scheuer?
Yes, I am.
Okay. So until I see you guys again, remember, be strong, be well, and be green. Bye-bye, everyone.
Now you can listen to Be Green with Amy expert interviews wherever you go. Listen while walking, meal prepping, or traveling. Find Be Green with Amy on Apple, Google, Alexa, Amazon, or virtually anywhere you find podcasts. Be strong, be well, and be green with Be Green with Amy.